message that I want to get across to my friends in Africa. Look at Latin America. We're in a disaster right now because of that.
Mm.
Um, we were not prepared for the cut of aid, of foreign aid, and we're not able to find our route because of all this demand from the private sector. And every time I go to Africa, I see the same thing. Even when I go to Mozambique, it's still considered a low income country. But just by seeing the private sector involvement and all the investment in the country and all of that, we start catering to that investment. And we forget about the nation building pillars of health and education and agriculture. And we start losing the best of our young people and talent that could go and be excellent doctors and nurses and teachers.
Welcome to the UMG Podcast. I'm your host, Jerome Sheldon. As always, we have a beautiful show for you today. Now, if you're new to this channel, we ask you to please like and subscribe in the link below. So, without further ado, let's get started. Welcome to the UMG Podcast. Okay, and so today we have a beautiful show lineup for you guys today. I have a very interesting guest. She's a dear friend of mine as well. She's a visionary. She has more than 20 years innovating in the use of technology for health system strengthening. And she's also a social entrepreneur and angel investor. She has spearheaded multiple initiatives, including the recently launched eSaver, a coalition of institutions and individuals that are committed to promote saver economic as an instrument of inclusion, participation, revitalization of local economies using exponential technologies. She's a dear friend, as I mentioned to you, and she's also leading an initiative to create impact funding mechanism focused on the civil economic in Latin America and also the Caribbean. And of course, she's the CEO and founder of Global um, Health or consulting, so to speak. And of course, she's an international partner with the WBAF, that's the World Business Investment Forum, and she's also the chair for the country of Panama. So, ladies and gentlemen, please welcome Arletty Pinel.
Hello, Jerome. It's a pleasure to be with you and with your audience.
Thank you so much, Arletty, for being on the show with us. Really appreciate you taking the time off. And I must say now, you are very busy. And so it's been a challenge there for me trying to get you scheduled. But thankfully, you are here today. So thank you for being on the program.
It's a pleasure.
Yes. Okay. So, as normal, what we normally do is we try to let our audience, our guests, get to know a little bit more about our guests, a little background. So, we're going to kind of go back a little bit in time with you so that you can kind of bring us up to par to who you are, where you started, how things started in your life. So, the first question, where were you born?
Well, I was born in Panama, which is a small country in the middle of the Americas, and most people know it for its canal, the Panama Canal.
Okay. Now, are you currently now in Brazil or you in Panama?
No, I'm in Panama right now.
Okay. All right. Because a lot of time when I usually communicate with you, you're in Brazil or again, you're somewhere up in Europe.
Yeah, like my friends always say, where in the world is Arletty now? So, but now I'm in my back home.
Okay. That's good. So, how was it like growing up in Panama?
Well, it was very interesting. At the time when I was growing up, we had the Panama Canal Zone, which was an area that was administered by the United States that secured the construction of the canal and is running until the year 2000. So it was very interesting ecosystem because I was Panamanian and from Panamanian parents growing up with all the Panamanian cultures and food and idiosyncrasies. But I went to school in the Canal Zone where my schoolmates were either American or they were foreign nationals that were here because they were children of people that came to Panama to work. So very early on in my life, I had all this international dynamism because my friends used to change every 4 or 5 years, and new ones would come. And this was this was really fantastic because it was very vibrant and learning to know my culture as it's seen from other cultures' eyes. So it really was great. But I was always very curious. So I couldn't wait to um, start exploring the world. My mother was a geography teacher, and I think I learned to read maps before I learned to read. So, and I remember even when I was in grammar school, um, uh, I my first geography um, writing, which I
Hmm.
was supposed to choose a country and developed it, and I chose Burkina Faso at that time
Oh,
because I was
wow.
just fascinated with Ouagadougou, and that started my connection with Africa.
Oh, wow. Wow. And you have an extensive connection with Africa, I must admit, too.
Yes, very
Wow.
much so. I started working in Africa in Mozambique during the Civil War,
Mm,
and we have a lot of African heritage in the Americas, not only in Panama but also in Brazil, where I eventually went and to study and lived almost 20 years.
hmm
But I started working as a consultant in Mozambique during, like I mentioned, the Civil War, and I just fell in love. I couldn't wait to go back to Africa every time. And since then, I think I've been to pretty much, yeah, I think only 2 or 3 countries are left, and I always feel very much at home when I'm there.
hmm
And because it's been several decades, it's interesting to see all the dynamics and how it has changed and where it's heading. And because of the where it's heading, I think that Latin America has a lot to offer, and I would really like to see more connection across the Atlantic between Africa and Latin America. Because as we get richer, if you will,
hmm
and we have more inequalities coming up, we need to find more creative ways of
hmm
dealing with financing and social protection and financial inclusion.
Yes, absolutely. So would you say the culture are pretty much similar? Uh, the African culture then?
Yes, because there are many cultures, even but there's a few things that are very particular, and that because of uh, the African heritage that
Hmm.
came to Latin America. Unfortunately, it came through non very nice situations because of
Hmm.
slavery, but it really was embedded in our cultures, and especially when it comes to, well, the Caribbean and Panama and Brazil and all the Caribbean coast and Cuba. And those things bring us very close together in terms of the appreciation of the music, of the
Hmm.
food, of the warmth, and
Yes.
the way that, and the collectiveness. I mean,
Right.
we're collective cultures. We like, the family, the extended family, the more extended family. We
Exactly.
like to celebrate, and so that's where I think we find our connections and trying to find solutions.
Yes, absolutely. So let me see if I can take you back into high school.
Hmm.
So what would uh what would Alexi like in high school? Studious? Well, troublemaker?
Well, I found the other day this page from uh, the high school newsletter
Okay.
that my mother had kept. And the title was Arletty, Perpetual Motion. So I guess that, yeah, when I was in high school, I was always looking for not trouble because I was a studious person and I was a very good Panamanian girl. but I was always trying to invent something. I had an entrepreneurial mind. I wanted to learn new things, do new things, find different ways of doing what oh, I was seeing. So yeah, I guess I was dynamic ever since then.
Interesting though, because I don't find that surprising. I mean, just a very short time knowing you, I can see all those personality, you know, weaver weaver in there. So, but that's a good thing. That's a good thing. And of course, you explore the world a lot. And some of the reason of bringing you on the platform too is the wealth of experience that you have, that you can be able to share with our listeners and our guests. I mean, our audience, so to speak. So we're going to try to pivot now a little bit into your career side of
Mhm,
things. Um, I found out that you were involved in technology for the most
mhm.
part, starting up in your early start of your career. How did that come about?
Okay. I don't have a linear career. I
Hmm.
have an interesting map of what I called my careers.
Hmm.
But when I left Panama to study, I went to the United States to study biology at the George Washington University. And there I was interested in cell biology.
Mm.
So I was a very micro oriented person, and I started working doing research with anti cancer drugs, but that were in vitro. Okay, so this was not on people, these were uh, tests that we were running in cells um, to test different types of medications and double blind studies, etc.
Hmm.
Two things happened at that time that really were pivotal to change the course of what I thought it was going to be my career.
Hmm.
The first one was understanding that the cells that I was working with, that we called HeLa cells,
Hmm.
were actually of a woman, an African American woman that had died from cancer in the 50s. And her life was continuing on in these cells because she had a very particular um, uh, vicious cancer
Mm.
that reproduced these cells. And these cells to this day are the ones that are used in the laboratory to study anything that is related to cancer.
Wow.
Her name Henrietta Lacks, and there's a book about her life, and I think it's important that people read it because it's not only about um, you know the inequality and growing up in a very divided country in the U.S. at a time. And but it's this thing, and I kept thinking, well, this woman is still alive in my
Mm-hmm.
laboratory and counting her cells. Shouldn't I be looking at the people that are owner of these cells? And this is the first thing that shifts me towards wanting to pursue medicine. Always wanted to do a doctor, but I was more interested in this finding new things, right?
Right.
And that's when I go to Brazil. I won't tell you the long story of how I ended up in Brazil, uh,
Okay.
um, but that changed my life.
Mm.
I went to study medicine, but getting in contact with Brazil is life changing, but not because of the Brazil and the samba and whatever. But it's actually because the richness of Brazil, and at that time it was under military dictatorship. So all the elements that had to do with social and political movements and understanding that, and then learning the culture through its music. That to this day, I'm just fascinated.
Mm.
Um, and that's when I discovered. I actually not dropped out, but there was a possibility of going away from medical school for a year,
Mm-hmm.
and then being able to come back if you wanted to. So I decided to do that option after my second year, and I joined a cinema group, and that's how I discovered Brazil.
Right.
And then I said, I'm starting to discover the meaning of my life. So when I went back to to medical school, I was just always thinking of this immense country with its people and its problems, and everything from the highly developed cities of Sao Paulo and Rio to up to the Amazon region and going through Salvador and Bahia with all the Afro-Brazilian influence. And I knew something was in the works. I didn't know what, but I knew something was in the works.
Mm.
And then out of the blue, I discovered something that's called sexology, and that
Mm-hmm.
happened through a book uh, that I found in the library, not the library, a bookstore that was
Mm-hmm.
on sale. It was called Handbook of Sexology, and I looked at that and said, "Huh, do people actually study that?" So I took the book. I still have it. It's enormous.
Mm-hmm.
And I didn't know at the time that that book was written by the most prominent researchers and academicians of the time studying human sexuality. And I was just fascinated. I couldn't let that book go down because it started with biology and would go with history and sociology and psychology, and then all the works.
Right.
So at that time we didn't have internet, right?
Right.
So I started writing letters, to the authors. I'll be in the U.S. this summer. I would love to meet you. And anyway, to make a
Mm-hmm.
long story short, I ended up at Johns Hopkins University with one of the editors of this book that happened called John Money, that happened to be a very prominent researchers in human sexuality, and he prepared a wonderful visit at the university. And after that visit, I said, that's what I want to do. So I started my career in sexology, but always working in weird things, right? Not the easy part. So
Right.
children that had been born with genital malformations, with people that had um, and I started working with sex education, which was a total taboo at the time.
Right.
That took me into HIV in 1982. I was
Mm.
called at the university hospital because that's where I was practicing, by the immunology department, saying, "We have a new disease. We don't know what it is. We think it's linked to sex. Can you help us take a sexual history?" And that starts my HIV career, which is the one that propels me into my global health career.
Oh wow.
And these 40 years following HIV from this unknown thing, into national programs and community-based programs, and then later on to to the big political areas, working. I left Brazil to first go to London to start up an experimental NGO to reach the communities with HIV prevention and treatment. And then I left to the US to work with the USAID project. And then my biggest startup, like I used to call, was being the founding director of the Global Fund to fight AIDS, tuberculosis, and malaria. Uh, I was in charge of Latin America and Eastern Europe, but working very closely with the rest of the world. And it was in that process before getting to the Global Fund. And in Brazil, I we used technology that was
Hmm.
available, right?
Hmm. Right.
So in order to be able to train, for instance, all the teachers of the state of Sao Paulo at a time when we didn't have internet, right?
Right.
We used the television, the public television. We established training, distance learning. We just bring together the teachers. Once every Saturday, we would transmit the class through the television. It was recorded in video cassettes, and that's the way that we taught, right?
Right. Right.
When I got to Washington, I came in contact with, by then the internet was there, but I
Hmm.
came in contact with what was the pilot of the African Virtual University that was propelled by the World Bank, and I
Hmm.
was fascinated with that. Satellite based transmission, and I looked and I remember um, putting together a format for Malawi where you could use the University of Mzuzu and be to get the transmission of the African Virtual University, and then go through education, health, and agriculture, and then come back, and bring together the community, and then feedback loops, and all that stuff. My boss at that time, and I thought, well, this is fantastic, and it's being used for business training. It's being used for training in technology. Why can't we do Africa-wide HIV training, right?
Hmm.
So I got to my boss, who was from Ghana, and he looks at me and said, "You're totally crazy. Internet has just arrived
Right.
in Africa.
Mm.
It takes forever to download one page. And here you're talking about using the internet to download books and maps and all of this." Well, that was one of my largest frustrations, not having been able to introduce HIV in this Africa wide transmission structure that I think could have contributed a little bit to scale up the professionals that wanted to work in HIV. But I
Mm.
just said, these are all examples. And then I started merging them as I would come. And I started getting involved with artificial intelligence many years ago. I started working with medical informatics and looking at following the pilots in Africa, which I thought, and mobile health. And I said, like, I'm sick and tired of these pilotitis. We need structures, we need ecosystems. And that's when I started weaving all this together into ecosystems that are either ecosystems of learning, ecosystems of knowledge sharing, entrepreneurial ecosystems, and financial ecosystems that we need. We sorely need new ways of funding, especially when countries go from low income into middle and high middle income status,
Mhm.
where we don't qualify for foreign aid because we're not poor enough,
Right.
we're not rich enough to have the structures in place, and everybody is looking at the private sector for wealth creation and
Yeah.
not social protection. So we sorely need, and this is one very important message that I want to get across to my friends in Africa. Look at Latin America. We're in a disaster right now because of that.
Mm.
Um, we were not prepared for the cut of aid, of foreign aid, and we're not able to find our route because of all this demand from the private sector. And every time I go to Africa, I see the same thing. Even when I go to Mozambique, it's still considered a low income country. But just by seeing the private sector involvement and all the investment in the country and all of that, we start catering to that investment. And we forget about the nation building pillars of health and education and agriculture. And we start losing the best of our young people and talent that could go and be excellent doctors and nurses and teachers into being technology, MBA, you know,
Hmm.
other
Hmm.
careers that are positioned as being shorter to train and
Hmm.
that you will get better pay. We're in that situation, and I hope that Africa doesn't fall through those cracks and really protects the health and the education and the food security of its people, because that's where the future of any country goes. But we really have to be very careful, and that's where when we need different ways of addressing with entrepreneurship, social entrepreneurship, social impact funds, and issues of that nature.
Yes, absolutely. And of course that's brings me down to Genos Global
Hmm.
Consulting, and
Hmm.
of course that's the objective, that's the mission of that project. Now, how did that come along? How
Well,
did that come about?
Genos started in Brazil in 1993
Okay.
as a way to train. At the beginning, the funding was starting to come into Brazil for HIV,
Hmm.
and we didn't have really strong NGOs. We had fledgling community-based projects, and so Genos came to be able to strengthen the capacity of community-based programs and NGOs and governments, local governments, to be able to respond to HIV throughout the whole continuum of care, from prevention to care and support. And so it had a social mission from the very beginning.
Right.
Genos, of course, when I started my international career and my associates also did that, Genos went into a pause.
Hmm.
And then years later, when I returned to Panama, something, I'm talking about the career. So I had my first career as a doctor, doing what doctors do, the second career in the global health.
Right.
And then I was up there. I was, at the UN and all these, discussions about macro politics and macro financing. And I'm like, I'm not happy here. I want to go back to basics. I want to go back to really feel and that I'm influencing in the life of people. So I decided, but I said it's time for a third career, but I didn't know what it was.
Hmm.
So I decided to come back to Panama after 33 years, just for a personal sabbatical of 6 months to decide what I was going to do when I would grow up. And then my dad falls ill and he passes away that first year. That I see my mother. I said, you know what? I can't leave. So that's when I relocate to Panama. And I continue my life in my international global health career, but more now as a consultant. But I started experiencing the difficulties of aging and the lack of resources and of solutions that we had not only in Panama but the rest of Latin America to respond to a very rapid aging. I mean, Latin America is considered the region that is aging the fastest in the world right now. So that's when I resuscitate, if you will. I reactivate Genos
Hmm.
now as a global enterprise, not only for my global consulting, but also to have a base to start spearheading and troublemaking. Saying, well, let's start grabbing the bull by the horns. Let's start learning about technology and health and aging and through Genos. Uh, think of Genos as a social sort of mm, engine
Okay.
that just wants to create a better world. So, so through it, we work with the universities, we work with government, we work with NGOs. Um, and in Panama, we have a couple of projects like eSilver that you mentioned, that it's more like a social lab of how do you bring together not only health, but from the perspectives and the needs and the priorities people over 60, which is not necessarily health.
Mm-hmm.
The first one that comes all over the place is financial security. People need money to survive. Second one is food security. The third one is breaking loneliness, and the issues that surround emotional and mental health, and then comes health as a whole. So we put all this together in this ecosystem that builds social enterprises, intergenerational social enterprises. We need
Right.
young people involved working with older persons. We're starting a project with Brazil now. It's a 5 year project. It's a hackathon that was started in Brazil for to get young girls from vulnerable settings to get interested in financial in STEM careers, and we're replicating it now in Panama, but as an intergenerational initiative with young girls from impoverished settings,
Mm-hmm.
with women over 60, and they have to, and the hackathon has to think about silver economy solutions, and we're coming in through the focus of financing, because it's a priority not only for the elder
Mm-hmm.
population but
Mm-hmm.
also for the young people. And starting, we have a this is done with the Oswaldo Cruz Foundation from Brazil, which is the largest public health foundation in the Americas. And we have a 5 year program. And starting in 2024, we're going to focus in Central America and the Caribbean, always with the idea of intergenerational woman and young girls groups to find technological solutions to address the needs of aging through a silver economy lens. And whether we continue with the finance, I mean, every country will find its niche. It could
Right.
be financing or health or education or tourism. I mean, but the core remains the same. And the idea is in 5 years being able to really create a community and an ecosystem, a productive ecosystem that starts looking at the new world of aging as as an intergenerational opportunity
Mm-hmm.
for social and financial inclusion.
Okay. Yeah.
So,
So so we'll come back to that
mhm,
e-civil economic project that you working on. Now, of course, like you mentioned, you went back to Panama and got the inspiration came in there, and of course, Genos Global Consulting. Now, can you give a little step by step how you were able to organize that? I mean, how did
mhm,
you put that into place? So, it's someone who, again, because part of the podcast here too is we have young entrepreneurs,
mhm,
innovators, trying to, they're on their journey,
mhm.
maybe just starting it, or some of them maybe already into the journey of things and, trying to navigate things and just trying to get them to a little bit understanding, from your perspective, some of the challenges and how sometimes to be able to resolve some of those challenges. So when you started off with the Genos Global Consultant, what were the steps that you had to put into place to be able to
Okay,
accomplish
the
that?
first thing is I was a foreigner in my country. I had been away for 33 years. This was a total different country when I came back.
Mm-hmm.
So I had to first get to know my country as it was,
Mm-hmm.
and then start scouting what would be partners. The first lesson I think is you can't do a revolution alone. So if you really want to do a transformation, you have to select which are your partners, both personal people that are committed, that are like-minded, but also the institutions that are crucial to promote and catalyze that change. And many times that's the most difficult part is
Mm-hmm.
it's how do you work with um, institutions that are used to more traditional, systematic bureaucracies and get them to, find ways to speed up the track because we live in a fast-paced world. We
Mm-hmm.
can't do the same things that we used to do, at the beginning of my career, where you would do the assessment, then you would do this, and then would do that, and maybe 2 years from then, you had something, right?
Right.
Right now, it's hacking the system, if you will. So you have to have a plan. You have to
Yeah.
have a very concrete plan. First of all, that it's built on a vision. You
Right.
have to have a vision of future. That's where it leads you. You don't need to know how you're going to get there, but you
Mm.
need to have that vision. You need to know that that's where you want to go. That's where you want to be. That's where you want your country to be. And then start saying, well, how do I get there? And some of it has to do with really learning. I was uh, sharing with some friends that I wanted to get this social impact uh, fund running. So I went to Silicon Valley and and for 6 months I was in a program. It's called um, the VC Lab, uh, and they wiped the floor with me because it's a totally different world than the world that I'm used to, right?
Right.
But we started like 350. I think we were less than 100 when we finished. But basically, it's like you want to do something new, you have to learn something new.
Right.
There's no shortcut to that, and that needs consistency. That needs getting to new things, being knowing that there's no easy or fast track to these things. You have to work yourself through the vines. But there are ways, if you know who can be your cool partners, who can be rooting for you and
Mm.
being with you along the way, then it makes the road easier because you're going to fail many times.
Mm.
Having good ideas is not the solution.
Right.
Many people, everybody can have a good idea at least once in their life. But to be able to have that good idea be a relevant idea for people and actually be a successful business, most of them won't be. So you have to be on your toes and you're learning and you have this idea and then you try it out and all of a sudden you realize that no, this is not going to work. Then you have to flip. You have to adapt it. It's, what am I learning? Where am I going wrong? Um, let's then go and go into let's make it better and try it again and try and try again. And if you have the constancy and that drive and the support that you need, because it's a hard work,
Right.
so you need, it's not just financial support, it's emotional support. You
Yeah.
need to be with people that actually can listen to you and help you and support you, and when you fail, be there to just cheer you to, so you don't abandon your track, right?
Yeah.
So get that support system in place. And it
Yeah.
could be your mentors, if your family, your friends. I mean, it's a little bit of everything, right?
Right.
So here you got, you start, you look at the future, you see what you want to do, you understand that what you want to do is not for you.
Mm.
Is you have to give before you can receive, right?
Right.
So when you have a business idea, what you need to do is focus on the needs of other people. It's what the people need. The fact that I have solutions that I've seen all around the world for aging doesn't mean that those are the solutions that Panamanian people over 60 want or need. So you have to listen, 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 listen. And from there, you start developing a participatory approach to developing the solutions. And then you structure the map, and then you
Hmm.
try it out, and then you start adjusting, and then build that support network, and then be able to learn new skills that are able to not only make you think and produce a better product, but also is able to present it to the people that can help you financially.
Yeah.
um, Pitching for money is serious stuff. And
Mm.
even now, with all the experience I've had throughout my professional life, I've managed funds up to $1 billion a year and whatever, and I'm still scratching the pot when it comes to living your vision.
Mm.
And it's always like where I'm going to get the money from, where I'm going to get it. I put money that I've managed to put in, but that's not enough. And usually people don't understand social impact. They don't understand the importance of social entrepreneurship. It's very difficult. If you say, I have a venture capital fund, everybody's lining up because everybody wants money, right? But
Right.
the moment that you put social into it, nah,
Mm.
I want to be a next unicorn. And I'm saying, I don't want to be,
Right.
you
So
know,
why you think that's a challenge? Why you think that's a problem?
because we have models that are, and this is, I think, very important. I mentioned Silicon Valley, right?
Hmm.
Because this is the model that has been flooding Latin America and most of the world in terms of um, investment, right?
Right.
And the route to it. And there's a lot of good things to structure that. But the drive behind it is the next unicorn. It's really
Mm.
more about money and having successful enterprises rather than making an impact. I wrote this little article. Maybe I'll share it. I decided I'm going to post it one of these days, but it just came out of my out of a lecture I was giving when somebody questioned about unicorns, and I said, "Listen, unicorns don't exist. They're fantasy animals, right?
Right.
Um, and when they come out in business, they only benefit a few people. They make a lot of people, some people, very rich,
Rich. Right.
but they don't benefit a lot of people, right?"
Mm. Hmm.
Uh, I believe in the donkey metaphor,
Okay.
which is something that I learned from my father. My father was an engineer, and he came back in the early '40s, graduated from an American university, the University of Southern California. He started working at the Panama Canal as an engineer. And one day, his boss said, "Guillermo, I want you to trace a road from the Panama Canal to those hills over there." So he was all excited with the technology that of the time that he had learned in the U.S., and he started charting things. And then his boss says, "Yeah, well, bring me a donkey and 2 sacks of sand." Okay, fine. Brought the donkey, put the 2 sacks of sand, and then
Mm.
the boss whipped the animal, and the animal started running and said, "Guillermo, follow the donkey because the donkey knows where you need to go." And that's how many of the small roads surrounding the Panama Canal were built. They were
Mm.
built on donkey knowledge. Um, and I remember that in a discussion about unicorns, I said, "You know what? I don't need unicorns. I need donkeys. Many, 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 many thousands of
That's
donkeys
one of the donkeys.
that know what they need to do,
Right.
know where they need to go, and have the stamina to be there. What come rain, come shine, they're there. They know where they have to go. And that's what we need to fund.
Hmm.
We need to fund people that are in the communities that know what the communities need. They know the problem. They know they want solutions. They can see the solutions.
Hmm.
Those are the people that we need to fund in one way or another. And some people may have the education to go into formal Silicon Valley type incubators, and maybe they become a unicorn in the future.
Right.
But most people, we're not like that.
Right.
We want to do good. We know what needs to be done, and we need a bunch of donkey
Donkeys.
stamina.
That is so true. You know, um, that's why it's so important, as you mentioned, it's not just about the education. I mean, I'm sorry, about the finance, but the know-how.
Hmm.
These are individuals, like you said, are on the ground. They know things. Tap into their knowledge. Just expand them. Give them the tools, that they need to be able to navigate, so to speak.
Hmm.
Um, and interestingly, though, for me personally, that's one thing I always, when it came down to Liberia, I also always think about the NGOs. At one
Hmm.
point, it was a lot of NGOs in Liberia, which were kind of good because there's a lot of impact projects that were needed there. But the problem that created to some extent was people began to rely on that as an entitlement, not on the sustainability part of things. Like, okay, how can we take this opportunity to be able to be creative in doing things that we can sustain ourselves here with, as opposed to, well, I just work for the NGOs, and then once they're done, once they're gone, that's it.
That's it. Hmm.
You know, how
Yeah.
how how can we address that?
Yeah. It's about sustainability and sustainable. You start tracing your map for sustainability from day one. Uh, I would say I come from a generation that when we used to do projects, it came to the monitoring and evaluation part, and we would say, let's put 5%, 8% on that in the budget,
Mm-hmm.
and we'll measure it at the end, right?
Mm-hmm.
And today, it was an appendix to programs. Today, monitoring and evaluation is the tail that wags the dog. You cannot get funded on anything, either for social or donations or financing, private financing, if you don't measure to prove that you're getting what it needs to be.
Mm-hmm.
So you start developing that monitoring and evaluation from day one. It needs to be there. It's your guide. So it's the same thing when you're doing when you're transitioning from foreign aid into more investments, whether they're social investment or microcredit or whatever. You start developing the plan of not only where you want to get there, but how you're going to continue. And one of the problems that I've seen with NGOs when they receive a lot of money
Mm-hmm.
is that people think that sustainability is only about money, but money is only part of the equation.
Right.
Social capital is one of the strongest and most important element of sustainability, and it's the most fragile when money comes in. And I'll give you an example because I saw this with HIV NGOs all the time. Money would come in, they would fund people that were really committed to their community. The community respected them as their leaders and whatever. But then you came with all the structures that you needed with funding. So you had management and then writing reports and then that. And the energy that before used to go to make people's lives better
Mm-hmm.
starts going towards making better reports, getting more money, and after 5 years, 6 years of that, then all of a sudden the money stops, and then
Right.
you have to go back and start from scratch. Then you go back to your community and say, "We need your help to get funding," and then community looks at you and says, "Since you know."
Yeah.
For 6 years, you've been living from us.
Right.
You've been getting the money. You've gone to the AIDS conferences. You traveled the world, whatever, and we're here you know, with peanuts.
Mm.
So why wouldn't we support you like we did in the beginning?
Right.
That's the first kiss of death of sustainability.
Mm.
So lesson number one, before even thinking about money, be sure that you never lose your social capital
Mm.
because that's the one that's going to hold you in the long run. The other thing that is involved is the political capital. You need
Mm-hmm.
support. And we know that when we work with governments come and go and come and go because we have elections and we have parties and whatever. So we need to have strategies of how we can maintain political capital. It's not politics, it's
Right.
political capital because at the end of the day, when changes happen in the country,
Mm-hmm.
it starts from the top. It's a responsibility of the top, you know.
Mm-hmm.
Like health, you know,
Yeah.
health. We need a Ministry of Health. We need
Right.
policies. We need laws, you know. And if not, we don't have a health system. Okay, so
Mm-hmm.
we need that. Um, and then we talk about financing, and financial capital.
Mm-hmm.
But money comes up and down, and we need continuation. We need we need accountability. So that's what drives long-term processes. And
Yeah.
this is probably one of the largest differences when venture capitals come in the Silicon Valley type
Mm-hmm.
funding.
Mm-hmm.
Is because if we look at Africa, it's very similar as Latin America. When our grandparents used to put a business together, they were thinking long-term businesses. They
Yeah.
wanted that business to go to their children, to their grandchildren. It was a family investment. It was investment of people's future, right?
Mm-hmm. Mhm.
The VC model is get rich in 5 years and then flip,
Yeah.
sell your company. Okay.
Mhm.
So there's a clash. How in the world are you going to get countries to
Right.
maintain sustainability if the young people are thinking that whatever they do right now, they're going to sell and become a millionaire in 5 years?
Mm.
They're going to
Mhm.
exit, right?
Mhm.
That's a
Mhm.
term that is used in financing.
Yeah.
Uh, don't follow that.
Mm.
Don't follow that. Think long term. Even if
Yeah.
you're old, if you're old, you never lose your dreams, right? You can be 100 and you're still dreaming about what to do next,
Right.
right?
Mhm.
Let that be your guide,
Yeah.
not, who's going to buy your business in five
Exactly.
years,
Yeah.
because your life is a continuous process. It's not just speckled with startups. No.
Right. That's why I think in Africa there's a more need for in terms of investment impact project.
Hmm.
That's what you need to start off from first, especially being
Exactly.
a emerging market and undeveloped places. Those are things that you need to do, and then you can
Exactly. And
and then
what
you can kind of scale up from there. Go ahead.
Yeah, and protect your ingenuity. There's
Yeah.
nothing better than for ingenuity than when you have needs. So don't think about, I don't need needs. I need to cover
Hmm.
my needs. No. Think about needs as the creative force for transformation. Find solutions for those needs. Think of it as the fuel that's going to run your car.
Hmm.
And because once countries start getting, richer, if you will, for whatever parameter is being used in the world,
Hmm.
ingenuity fails. It's start becomes scarce because then we import solutions, right?
Right.
And we have to hold very strongly to our solutions. And I've seen fantastic stuff happening in Africa that could benefit the world. But, I said, no, but I want money, I want this, I want that. And then look what the US or look what Europe is doing. I want to do that. And
Mm.
that's when the fantastic solution that could have helped the whole world, including the US and
Mm.
including Europe and including the big countries, the rich countries in Asia and the Middle East, they die
Yeah.
because we focus on ready made solutions
Yeah.
and not building the ones that really make an impact in our lives, in our communities, and in our countries.
Yeah. So, so going back to Genos, how has Genos helped Africa, or has it helped Africa in a specific way? Have you
Well,
been?
yeah, through Genos, we have had different possibilities of doing things as consultancy, but I really would like to push that further,
Okay.
and maybe together, Jerome, and
Hmm.
with Liberia, this could be a good moment to think about this African Latin American connection
Right.
and how we could work together. And definitely through Genos, we're there. We want partners, and we want partners from the heart. We don't want partners just for the money. You know,
Right.
that doesn't last. We want, you know, my grandmother used to say, when you lived long enough, you start seeing things come, in a circular fashion, and you start history repeating itself. And
Hmm.
I think I've lived long enough to start seeing that. And even when I mentioned that my first experience in Mozambique was during the Civil War, but I remember fantastic solutions that were being done during the Civil War. There were no doctors, you know.
Hmm.
Um, so what would happen? It was Civil War. There were landmines. There were, it was the nurses that were being trained to do very difficult surgeries that would be sent to Zimbabwe. They would be trained for a couple of months. They would come back and they would learn. And they had the most fantastic programs, women's programs, young people's programs, and things like that. And those things had been lost for
Mm.
other types that are needed. I mean, you need doctors, right? You need doctors,
Hmm.
but
Hmm.
not at the cost of looking down on the rest of the workforce. Because the health workforce that maintains the health system are the people underneath the doctors. I'm a doctor, but I'm sorry. you know, it's the nurses, is the logisticians, those are the people that maintain uh the health sector, you
Mm-hmm.
know. We get
Mm-hmm.
the credit, let's put it
Right.
that way. You know, we would be no one, you know, without that help. And they've been seen as second and third class citizens and fourth class citizens, and sometimes not citizens at all, especially if you're in hard to reach areas. We need to turn that around. We need to take those hard to reach areas and those people that are there with facing every day the responsibilities of that without any support. And we need to turn their realities around. We need to take technology and investments there, not look at the universities and whatever. That's fine for that,
Right.
but why don't physicians and people that go to university and have that opportunity return to their home communities? Because they're also thinking about their children.
Mm-hmm.
You know, everybody wants a better life for their children. And why are you going to go to an area nobody looks at and there's no good schools, there's no good sanitation? There, you think, what type of life am I bringing to my child?
Mm.
So we've, but if with technology and with exponential technologies, we can turn that around because we can have super fantastic technological hubs in the middle of nowhere where nobody wants to go, and then turn it appetizing for people to want to go there. And not just because it may be paying more, because you're going to find the innovation and the connections and international connections that you won't even find in the capital city. This is
Yeah.
the way that we have to start thinking. We have to think about the networks. We can't do it alone. So,
Right.
what are the networks, the institutional networks that we can build collectively and distributed? So, the strong universities help the weaker institutions. So they grow together, not like, you know, oh, I'm the big Harvard type, you know, university, and you're like, you're a community college. No,
Right.
it's we all should rise up to the challenge and rise up to the quality, and we can only do that if we inverse the our parameters of thinking that we start from the top and then eventually we'll trickle down.
Trickle
That
down.
doesn't
Right.
happen. We
Yeah.
start at the bottom, we grow it up, and then for the people that are working at the higher levels, somewhere it'll meet and then it'll come together. And that's, but if we don't invest out there where it's needed, with the
Mm-hmm.
little donkeys that are there,
Yeah.
um, we're not going to get anywhere.
Yeah.
That's not where prosperity lies.
Yeah. Absolutely. Absolutely. And that's why it's so important when we speak on the continent of Africa, because when we look at the global scene, Africa is, like you said, it's at that bottom, at the bottom right there. And it's rather than you trickling things down, you got to start from the roots, and bring them up, and
Yeah,
then they play.
and start with preserving something that is very important,
Hmm.
which is your pride,
Yeah,
your conviction that you have something to offer this world, and not that you're there like us. Can you give us something? You know, no.
hmm,
Position yourself as we have things to give, and this is what
yeah,
we can give. But to be able to do that for the world, for the country, we need your help, and this is the type of help that we need. Do the exercise, ask, but
yeah,
go specifically where you want to ask, and not let others decide for you.
absolutely. Yes, that definitely makes sense. Okay, well, that Aleti, we really enjoy the conversation here with you. And so I'm going to do one thing, as we mentioned earlier. This is the segment now of the show that we talk about the 5 for 5. So,
Okay.
so that's where we ask you 5 nice questions, but the goal there is to see how rapidly you can respond to these answers. I mean, these questions, but no pressure though. No pressure.
Okay.
All right. So let's go ahead and get that started. Okay. So the 5 for 5. So the very first question we have here is the best advice that was given to you.
The best advice that was ever given to me was to, well, I had to actually two. One was from my parents, from my mother, that said, don't put any boundaries. Don't always respect intelligent people. Don't be afraid of them. You know,
Mm,
don't. That was my first personal advice, and my second professional advice came from a professor that said, if you're in the new ground, and I
mhm.
mentioned mine was sexology, validate that. And that's why I became a psychiatrist. And that was the best professional thing. I did work and I like psychiatry. Of
Right.
course, I fell in love with it, but I had already a vision that psychiatry was a means to really validate the important work in sexology.
Yes. Okay. Thank you. The next question is your favorite food. I know.
Mangoes,
Oh my
mangoes.
goodness. You talking about the mango fruit?
The mango fruit. Yeah.
Oh wow. Why is
That's
that
my
the favorite?
total best favorite fruit. And anything that stems from it, I love it. Mango chutney, mango this, mango that. But the fruit itself for me is the most luscious and delicious thing. We're
Yes.
now in mango season here in Panama, so I'm very happy.
Okay. I know in Liberia we have different kinds of mangoes. I mean,
Yes,
of
we
course,
do too.
we got
Hmm.
different names back home,
Hmm.
Gemma plum, things like that. But yeah, they come in a variety too.
Yes, in here too. But it changes around the world. So, Jerome, when we go to Liberia, be sure it's in the mango season.
I sure will. I sure will. I sure will. Okay. And so the fourth question here is your best vacation location.
That's difficult because it sometimes can be just a hammock in my house when I'm so tired. There's so many things, but I'm more of a beach person. I love the sea. So
Hmm.
anything that has water
Hmm.
uh, is probably my favorite spot.
Gotcha. Okay. And last but not least, your last thoughts for the UMG family that listening.
Be strong,
Hmm.
grow, and bring a bunch of little donkeys that we can work together with Latin American to really create a transformational force.
Yes. Thank you so much. It was a pleasure and an honor to have you on the podcast, to be able to share your wonderful journey. And like I said, you are still moving in that
Oh,
direction.
yeah.
Yes. So we wish you the best in that. Hopefully, we be able to get you back on the show again, where we can have our audience to be able to ask questions. Because we have a segment that's going to come up about questioning, and so they can
Mhm.
be able to ask you questions.
That'd
But
be
yeah,
great. That'd be great. It's been a pleasure. Thank you
yeah,
very much, Jerome, for the invitation, and thank you for the audience. I hope this can be of a little inspirational, and I'm looking forward to more collaboration and more thinking and more action. We need more collective, positive things. We're so flooded with not too good things.
yes, absolutely. Yes, yes. Thank you so much. And so, for our audience, thank you so much for being with us on this wonderful podcast. Of course, the objective here is we hope that you are able to take away something, a little bit, that you can add on to your journey as well. So, as always, jump, but don't jump too high because you have class. We'll see you in the next episode.